Kind of feels like a lifetime ago, and also kind of feels like just yesterday, but today marks 3 years since the first COVID-19 case was officially confirmed in the U.S. The first case was found in Washington State, just north of Seattle, on January 20th, 2020. The patient had recently returned from Wuhan, China, where the virus first appeared in 2019. Later, studies found evidence that the virus was in the U.S. weeks before the first case was officially confirmed. Since then, the U.S. has reported 102 million cases. That is more than any other country. More than 6.7 million people have died globally from COVID-19.
Joining us today is Dr. Payal Kohli, and I can't wrap my head around 3 years since we started this. That was right around the time you started working with us.
It really was.
Like, welcome to your first month.
Seriously.
Well, and I feel like we've been in a time warp because just as you said, Alex, everything seems to have sped up. I mean, scientific discovery, innovation, all the things that we learned. But at the same time, it feels like just yesterday where we would not wear masks and not worry about infections and not think about viruses. And, you know, I feel like to me, the most striking thing has been everything that we've lost, but also everything that we've gained. So it's just the paradox of the whole situation. All the lives we lost, you know, all the time we lost, the work hours we lost, we'll never get those back. But if we think about the innovation, the prevention, the way that science really stepped up to make vaccines, to make treatments about something we knew nothing about, I feel like it's shown us the path forward if we were to ever see this again.
And I feel like life has changed for all of us. It'll never be the same again. But like you say, when you talk about the innovation and some of the positive things that have come from this, how do we look forward and what health risks should we be concerned about?
Yeah, you know, I sort of, in my mind, when I close my eyes, I think about like a battlefield after a war has been fought. From the medical perspective, that's what we as providers think, because the collateral damage that's been left behind after what we've survived through has been incredible. So I'm going to start with heart disease. You know, we know that heart disease obviously was already the #1 killer, but now we know that heart disease mortality, or risk of dying from heart disease or developing heart disease, has increased substantially because of the infection. So some of us have gotten the infection because of the effects of that. And for some of us, because we didn't get access to care and what have you, the impacts on cancer and cancer screening, the impacts on mental health and substance use, some of which are going to stay with us forever, and the long COVID. For those of us that are living with that disease, it's a whole new disease that we have to now tackle.
What about some lessons we've learned in all this? Where do we begin?
So many lessons, right? You know, for me as a person, as a doctor and as a scientist, I would say the biggest lesson has been humility.
Yeah.
And not taking disease and science for granted. And I would say as an adjunct to that, the second lesson has been preparedness, because we really were not prepared for what we had to face. We didn't know what we were dealing with. And I'm just hopeful that the lessons that we learned about scientific development, about research, about transparency, about communication, all the mistakes that we made have taught us moving forward what would happen if we were to ever face this kind of a threat again.
And 3 years later, I feel like so many of us are still healing from losses that we've had. I mean, emotionally, physically. Any advice for us from your perspective of like how we can move forward and heal as one?
Yes, I mean, I think we all need to heal on an individual level, as a community, as a society. And I think the biggest advice is that it will take time. It's a natural process. After any kind of damage that you've sustained, give yourself time. But the other piece of that is if it's taking too much time, you know, if you're feeling like you're not able to return your life to normal, you're not able to get over the fear of getting the virus, you're not able to enjoy the things you enjoyed, or they're lingering mental or physical effects that are staying with you, then it's time to reach out for resources, either family members, friends, or your physicians, to really help guide you, because each of us is going to have a different healing journey, and we have to help each other on our journey. But at the same time, we have to be mindful that if it's not going the way that we should moving forward, then we might need to reach out for some help.
Yeah, I'm glad that you say that, because I don't think you can say that enough.
Nope.
Like, if you need help, the first step is asking for it.
Right.
Thank you.